Hello, I'm Fei Kwan and you're watching It's About Youth. According to the 2023 National Health and Morbidity Survey, around 1 million Malaysians aged 15 and above are suffering from depression. Now, alarmingly, this is a figure that has doubled since 2019 and it seems to be more widespread among younger age groups. Joining me on the show today to discuss this further is Dr. Prem Shanmugam, founder and CEO of Solace Asia, and Benice Malini Samarasena, a counsellor at the Safe Harbour. Welcome to the show.
Thank you. Thank you for having us.
Now, firstly, this apparent increase in depression cases among young people, I have to ask the both of you, is this something that aligns with your observations and your experience with clients on the ground? Benice, shall we start with you?
Yeah, sure. Definitely. I think what's more worrying is that these statistics are referring to those who have been diagnosed, whereas there are a lot that are not reported yet. So we're talking about those. So for young people, youth and young adults, so youth, their access to mental health is depending on their guardians and their parents, right? And for young adults, you're starting out, you're working, you don't have that money or funds to seek mental health support. And then we have migrant workers and refugees. Those are also largely underreported stats. Yeah.
And so, Dr. Prem, the survey, it kind of highlighted a prevalence of mental health problems, specifically those aged 16 to 29. You know, is it really an actual increase in cases, more reporting? What's it like for you?
Okay, well, I have to agree with Benice that, you know, the statistics that we see or the numbers that are reported are cases that have been identified, yeah? That means cases that actually people who have gone to see a doctor or a clinician and got themselves diagnosed, you know, or then it comes out in statistics. And generally speaking, statistics, they show us the problem, right? They want us to see the problem, so then we look deep down and we dive down and we look for solutions. So to answer the question, yes, there has been a rise, but at the same time, I also think there has been more awareness of the problem. So more people are realizing that, okay, if I feel this way, these are the symptoms, and therefore I have this problem. And there's also been this issue of over-diagnosing as well. Yeah. So it's complicated, actually.
So what would you, I know it's a very complex question and it's kind of different case-by-case basis for everyone, right? But what would you say are some of the underlying causes that are contributing to poor mental health among our youth?
Okay, now if we're talking specifically about youth, in fact, Benice and I were chatting earlier, like looking at those between the ages of 5 to 15, as it was reported, yeah? These are school-going kids, okay? And generally speaking, school-going kids, when they do go see the doctor, see the clinician themselves, parents take them. And one of the common things that happen with doctors is, okay, maybe I shouldn't say it on air, but they're very friendly with, you know, medication. You see, they prescribe medication. It's very rare that doctors actually look down, go down and try and talk about what's happening at home. Are these symptoms of something else? Symptoms are not the problem. You know, symptoms are just symptoms of an underlying problem. Yep. I'm sure Benice would agree with me. So we have to go down and find out. It could be domestic issues at home. It could be dysfunctional parenting styles, you know. Or it could be bullying in schools, as we hear very often now. Yeah. So, yes, the kids are coming up and talking about it. Parents are bringing them. But I think we need to go down and try and identify what is the underlying cause and what is the root cause of all these issues.
Definitely. And Benice, you know, earlier you mentioned a little bit about refugees as well. Lack of access to mental health support is one thing, but what are some of the factors that are leading towards poor mental health? With
refugees, you mean? Abuse. A lot of them are victims or survivors, if they have access to mental health care, of abuse. You know, they come in here, a lot of them don't know the system. It's cycles of poverty, you know, that they are locked into, and then often they are they fall into hands of predators that prey on their circumstances. And it's what is very sad is that we're talking about intergenerational trauma here, so it gets passed on. Yeah, from the parents that come here and then to the children, that come here again, etc. Yeah, so those are issues that we're dealing with.
And it's not something that's highlighted as much. It's not really included in national figures.
No, it's not.
Yeah.
It's not.
And a lot of this is what I'm assuming is what you're hearing, your experiences on the ground as well.
Yeah.
These are unreported statistics also, you see. So the problem is actually worse than what we know in the country. There's another set of population. We're dealing with different populations, right? We have different socio-economic groups, and then we have the migrants, and then we have the foreign workers, and even like the foreign workers who come in here, domestic workers or foreign workers. They check for medical issues, they need to pass. Then of course all the documentation and all those things before they're given a permit. But there's no mental health check that is done, you see. So when they come here, only then we find out they may have depression or they may have anxiety or some bipolar cases, then by the time we pick it up, it's a bit too late.
Yeah, and hence the importance of including mental health in our practices, in our screenings.
Exactly.
Okay, but that's another thing, right? Because it is not, I would say, normalized in certain health checks at the moment. A lot of young adults are struggling with this, also due to lack of perhaps accessibility, lack of funds. If they're young adults, they would be students or people who are just beginning in their careers. How do you think we can sort of address this lack of accessibility and support for younger age groups? Benice?
Right. I think definitely we have to make mental health services more accessible, but especially when we're talking about a demographic that does not yet have earning power, right? So I think making it accessible is very important. And I think second thing is normalizing seeking help as much as we can. Talk about it, health screening in schools, social media, whatever it is that, that movies, series, etc. Those are ways that we can make mental health. And I think another thing, peer support is very important in this age group. So if we are able to help them build strong communities and support groups, like for me personally, I have cases where young people make calls for their friends to seek help, mental help. So if that becomes more of a psychosocial education is made available, then people will be more willing to seek help. Yeah.
There's also this reluctance to seek help due to that stigma that's still tied in with poor mental health, right? How do you think we can encourage more open conversations regarding this topic, and to sort of to be able to encourage people to come forward and tell them it's okay to ask for help? Prem?
Okay, I have a take on this. I have maybe a slightly different take on this. I think, in fact, what we are doing now is education. Right? We are creating awareness, we're talking about mental health, we're talking about stigma. For example, my core work is in addictions. That's what we do. Initially we started off with addictions, and then we realized it's related to mental health. Then we always said, oh, there's a stigma around people seeking treatment for addictions. But I think over the last 10 years, I think it has changed.
Right.
The scenario has changed. People are talking about seeking help. People are coming out and seeking, maybe the next issue you should look at is affordability.
Yeah.
Yes.
I think that's the key thing, as you said, Faye, earlier, affordability. To make it affordable to everyone, so everyone can get help. If they can't afford to go to Solace, for example, we must have somewhere where we can refer them to. Or we must have, like Benice does a lot of work with VWOs, right? So they must have access to these agencies as well.
Yes.
That's one. The other thing I realize also, I feel, is that the younger generation today have changed, they're more open to using terms like, give me space.
Okay,
I need my time. These are my boundaries, I need to be assertive in relationships. And these are words that I never knew existed when we were growing up. It was all discipline, discipline, discipline. So they have changed, they have. Stigma is being lifted. It's not as bad as it was. And I have to say, the pandemic has helped.
Okay.
In that way. Because the pandemic and the lockdown has created so much of awareness, you see, that these things do exist. The pandemic may have caused or may have exaggerated the symptoms a little bit in that sense, but these have always been there.
Yeah.
Mental health has always been an issue, but the pandemic and the lockdown has forced us to recognize it and start to work on it.
Benice, what are your thoughts on this? Anything to add on?
I think Dr. Prem summarized it very well. I do think, yes, the tide is changing, and I think very much so Malaysia is ready with regards to mental health to move into the second phase of like making mental health access very much affordable and available to all. Yeah.
Well, that's very reassuring to hear. You know, on to the next step of affordability. Then, where can we even begin? I think is the issue. Why is mental health? Firstly, why is mental health support so expensive, and how can we help our youth to have access to these services at an affordable rate?
Maybe I can try and answer that. Training. I think it's a lot of education and training. Now today, I'm aware that there are more youngsters coming out and taking psychology degrees, specializing in counseling and psychology, because psychology is now the in thing. I want to be a psychologist, I want to be a counselor, you see. And that is helpful. But the next thing we should look at is standardizing clinicians or psychologists, giving them proper training, giving them the accreditation they need, allowing them to specialize. A psychology degree is a degree, but you can specialize as well in various areas. I think we should allow them that opportunity. So we need more training and education. In the Ministry of Health, we have counsellors and we have teachers who are trained for counsellors, but they are not mental health specialists.
Right.
So schools still need that support. And we go and do, I'm sure Benice also does, we go to schools and we talk about the various problems with mental health disorders and how to seek help, talk about it, we open about it. We do training for the counsellors as well. So that's one way I think that would help.
Okay. And just to tap into that just a little bit, there is, going back to stigma and maybe certain perceptions with mental health, there are arguments thrown around social media that the current Generation Z and younger, seem to lack resilience. But you are saying that no, they are actually just more aware and they're drawing their healthy boundaries. How would you perceive this gap in perceptions among different generations, Benice?
I think first we have to look at the Maslow's hierarchy of needs, right? It's first of all, when you don't have your safety needs met, it's very hard to self-actualize, right? That's one key point here. And when we look at mental health, there's so much factors that go into what causes mental health struggles. Resilience is just a very tiny factor. In order to kind of explain it more holistically, we have to look at the biopsychosocial model of what causes mental health struggles. So I think we have to factor in this 5 to 10 years. This generation has been through a lot. There's a war in the Middle East, rumors of war in Europe, and also a lot of young people now are unemployed, etc. So it's hard to, develop resilience as a muscle if your basic needs to shelter and food are not being met.
Definitely. And then there's the whole anxiety with the climate crisis and uncertainty with the future. As you said, a lot of factors contributing to it. Are there any key strategies for the community then to implement for early intervention among young people? Is there anything that can be done effectively to address this?
I think as I said earlier, education is very important. You see, I give you an example. Defining what's depression and sad is also something we need to understand. Just because I'm sad, it doesn't mean I'm depressed.
Right.
I can be sad. I got into a fight, my mom scolded me, or I got into an argument with my partner and I'm upset. That's sad, upset. Depressed is the clinical thing, where there are certain symptoms we look out for. Loss of appetite, inability to sleep, inability to function, loss of purpose in life. That is depression, where it's clinical. Sad is something where I'm just upset, I'm sad. You don't have to go see a doctor to get medicated for it. So this education is important. We need to create this awareness with students, youth especially. Because now with information access, everything is speed. We were having a chat earlier and we see today even me when I'm on my phone, anything that's more than 1 minute I don't read, I swipe it, right? We want information in short bursts.
Yeah.
We don't have time to focus, so it's speed. And that in itself has given us symptoms of ADHD.
I see. Okay.
You know, so these are some of the I'm not organically ADHD, but because of technology and the need for information, the need for quickly grasping things, I'm becoming like that.
Right. Okay.
So this is some awareness that we need to create. Now, just because your child is hyperactive or your child is doing many things, your child is, you know, trying to function in many areas, it doesn't necessarily mean he has got ADD or ADHD. He's just an active child. So this awareness, this education needs to go out to the public as well.
Yeah. Okay. And then I think that's a very interesting point to highlight. In the future, learning to sort of navigate our technologies and social media as well, and learning how it ties in with our mental health.
Yes.
Benice, what do you think? Are there anything that strategies that communities can implement for early intervention?
I definitely think that what can actually go into enhancing our education system is giving our young people life skills. For example, psychoeducation, social education as well, for mental health, well-being. How do you look after yourself? How do you develop good resilience? Even we're talking, if let's say we want to attack the issue of unemployment, what is good finance education? You know, I think those are very important life skills. So that is one thing we can do. And then I also think because of media exposure, we need to create avenues whereby our kids or young adults can process whatever it is that they're taking in on social media. Okay, let's talk about whatever you saw on the media today. You know, what would be a good way to, I think in classroom settings, we can train teachers or even mental health professionals to process this with our kids so that we know what they're thinking and we can curb issues early on. Yeah.
And I like what you said earlier also when it's about training peer support groups, right? Among the students themselves, you know, train them to be how they can support each other. Peer support groups.
Yeah.
We see a recovery happening better and more acceptance among groups than with individuals.
I see.
Yeah. So if I go see a psychologist, I may have a little bit of, you know, mistrust or a little bit of issues in building a relationship. But if I'm a group of people who have similar issues, I bond better.
Yeah.
I see. Okay.
Yeah.
And how does that aids with recovery because they are able to support each other?
Yeah. Because firstly, I identify that I'm not alone with this problem. There are others with similar issues. So immediately I connect, you see.
Yeah.
So I won't struggle to disclose or share what I'm going through.
Yeah.
Whereas with a professional, I may take maybe 2-3 sessions before I actually build a relationship,
Yes.
a therapeutic relationship. It takes us a while, even us as professionals, when we work with patients or clients, it takes us at least 3 to 4 sessions before you actually build that trust.
Yeah.
And only after that, the clinical work may start to happen. So peer support groups are good, really helpful.
Will you see this as, you know, peer support groups, or with the existence of social media, are there any other emerging challenges or opportunities that you believe we should be aware of? Benice, we'll start with you.
I think first, for example, sometimes there is the misconception that whatever young people do, their coping habits is all bad or detrimental. That is not exactly true. If we can learn how to use these tools, like for example, let's take gaming, right? I mean, anything excessive is not healthy, right? But if we can actually implement gaming in a way that relaxes the mind, also has elements of mental health, you know, in it, that can be educational. That's number one, right? And then number two, again, like I mentioned, media that conveys good education and normalizes what mental health is and is not, you know, seeking support. And I think the third thing is also, what Dr. Prem said, there is healing in communities. So equipping communities like Facebook groups, that is, I have actually recommended that to clients before, you know, and that is just an example of common hobbies, and you develop friendships and supportive communities from there. So I think those are avenues that we can tap into. Yeah.
And how about you, Dr. Prem?
Well, another area which is important now is workplace. And we are seeing youth coming out, I mean, looking for jobs here. the youth today looking for jobs, their needs are different from the youth in the past. And I would say past, I'm referring to even pre-pandemic period.
Right, yes.
Because today people recognize that they need a work-life balance. We never knew what work-life balance was, or we never stressed the importance of it pre-pandemic.
Until we saw those lines
Yeah,
blurred
exactly.
working from home.
Yes.
Yeah.
And now people are comfortable working from home, so they want that ability to work from home and that trust with the employers, you see. So it doesn't mean if I'm working from home, I'm playing truant or I'm not responsible. It doesn't necessarily mean that. So employers should recognize this. At the same time, there needs to be a balance, because we see working from home can sometimes be stressful as well, because there's no boundaries.
Yeah.
I get up in the morning, you know, if I'm going to office, I need to dress up, I need to wear my, you know, my clothes, my uniform, I need to drive. So there's a structure there.
Sort of a routine.
Yes, a routine there. But if I'm working from home, I can wear my pajamas and sit in front of the TV and just switch off the screen in front of the LinkedIn, or sorry, the Zoom, and switch off my camera. And I'm still working. And then there's a cross of boundaries, because children, partners at home. So employers need to recognize that the youth today's needs to work are different from what it was before. And I think today they're not so fussy about salaries as they used to be. That is not the priority now. The priority now, yes, I need a decent salary, I need to pay my bills, but I need my lifestyle balance. As a hierarchy of needs, exactly as what Benice shared earlier, that balance needs to be there. People are recognizing that in a good way. In a good way.
In a sense, prioritizing their mental health without that bullying. Right. Thank you so much, the both of you, for sharing your insights. It's been a pleasure having you on. I've been speaking to Dr. Prem Kumar Shanmugam, founder and CEO of Solace Asia, and Benice Malini Samarasena, a counsellor at the Safe Harbour. This has been It's About Youth with me, Faye Kwan. Thank you for watching, and see you next time.